Well, hello, everyone. My name is Dr. Jean-Sébastien Rioux. I'm an associate professor and scientific director of the International Policy and Trade Research Division at the School of Public Policy, University of Calgary. And I'll be hosting today's Policy in a Pint webinar. And as the name implies, you're allowed to have a beverage of your choice as you view this, because normally in the before days, the before times, we've held these events in a real live pub, but today we have to do it virtually. And I have some exciting news to share. The School of Public Policy has been named on IDEA's RepEx list of top policy schools of 2020. We ranked number 33 on the global top 25% of policy schools. The School of Public Policy is the only school in Canada to have made the list, appearing alongside schools like Harvard, Columbia, and Stanford, to name just a few. So we're pretty happy about that, and thank you for your support as we've achieved that really amazing milestone. I have a few housekeeping items to share with you. So first of all, if you have to leave early, that's okay, because recordings of the webinars are posted on the School of Public Policy's website, and you will receive a link to that recording in a follow-up email. We also, throughout this event, will throw some polling questions for you, the audience, during the program. So we encourage you to participate in the poll, because sometimes we'll gain some really interesting knowledge and we'll be able to speak to the polling results. Towards the end of the program, or at least in the second half of the program, we'll have about 40 minutes saved for questions and answers from you, the audience. So please type your questions in the Q&A box that appears at the bottom of your Zoom screen, and I'll read them and ask them to our speakers. So today's panel discussion will be on the fight for the vaccinable middle, public attitudes towards a COVID-19 vaccine in Canada and the world. The rollout of several COVID-19 vaccines presents public health authorities in Canada and the world with a new policy challenge, convincing an increasingly distrustful public to get vaccinated. What is driving the apparent increase in vaccine skepticism, and what can public health agencies do to improve public acceptance of vaccines? To discuss the influence of social media, the growing distrust of institutions, foreign actors, memes, and how governments can win back public trust, we've assembled a distinguished panel of experts who are working on this issue right now in real time. And today's panelists are Dr. Cora Constantinescu, MD. She's a physician specializing in pediatric infectious diseases at the Children's Hospital here in Calgary. She lives all things vaccines, from seeing vaccine hesitant patients in her clinic to reviewing immunization reactions and doing research on vaccine safety and factors affecting vaccination hesitancy and behavior. She's part of the 19-0 team and continues to be an advocate for vaccines at a local and national level. Dr. Raj Pannu is co-founder and CEO of Emergence. He holds a Master of Science in Immunology and a PhD in Biochemistry from the University of Alberta. His specialty is formulating large-scale communication strategies for health initiatives. When he was Director of Global Health at McCann Health, he worked with a wide range of multinational companies and not-for-profits, including the Bill and Melinda Gates Foundation, USAID, and UNICEF. And our third panelist is Dr. Jean-Christophe Boucher, an assistant professor and program director here at the School of Public Policy, University of Calgary, and in the Political Science Department, University of Calgary. He specializes in international relations with an emphasis on Canadian foreign and defense policies. But he is here today because of his expertise in studying social media behavior and analyzing massive data sets to uncover trends and behavior of millions of social media posts. He's currently consulting for Alberta Health Services on these issues. So now I'm going to ask each panelist, starting with Dr. Cora, to speak for about 5 minutes on their work, as it happens right now, on this COVID-19 vaccination program. After Dr. Cora, we'll move to hear Dr. Raj Pannu and finish with Dr. Boucher. I will then moderate a short discussion among the panelists, and then, as I mentioned previously, we'll open up to audience Q&A. So, without further ado, I'd like to turn it over to Dr. Cora Constantinescu. Thank you.
Thank you very much. I'm going to share my screen. You see, they all tried to convince me that this is really laid back, but the pediatrician in me could not impose my slides upon you. So here we go. Let me make sure you're all seeing the right view here. So I'm going to talk to you a little bit about vaccine hesitancy, and specifically how we can empower and prepare our healthcare workers to deal with vaccine hesitant patients, but also colleagues. And many things have changed over this pandemic, but the one thing that stayed the same and unchanged is that healthcare workers are still the most trusted and influential source of vaccine information and for the vaccination decision. So here we are trying to help our healthcare workers accept their concerns and denial are natural. But whereas healthcare workers are quite well trained at dealing with education, correcting misinformation, there is a bit of understanding that denial does not just stem from ignorance, and there is an emotional and behavioral gap that needs to be bridged before we can say that people are ready to take on the vaccination decision. First of all, where are we at in terms of vaccine hesitancy across Canada? This is work done by Angus Reid. They've done this starting in the summer when they asked how many Canadians would be ready to take a vaccine as soon as it's available to them, just under 50% in July. And then this has dipped a bit in the September and fall months, and now we're around 60%. What I want you to know, and is interesting, is that it doesn't matter whether you're a healthcare worker or not. This number is the same, around only 60% ready to take a vaccine as soon as it's available to them. So what are some of the reasons for this vaccine hesitancy? So the big reason, one of the big concerns is confidence. So people talk about lack of trust of governments, health agencies, concerns about safety of the vaccine. We've heard concerns about complacency. Complacency means how do people look at the risk of the disease versus the benefit of the vaccine, and also issues with convenience, which is kind of interesting. This works its way into scarcity, accessibility, and even think about sick days. So you may have a healthcare worker who may be reluctant to take the vaccine, concerned they may get a reaction like a fever, or let's say a sore arm, cannot go to work. They don't have sick days to enable them to overcome this reluctance there. Other things that I know JC is going to talk about is calculation. So where do people go for vaccine information? And then a big one is collective responsibility. So we're going to recommend vaccines to people who do not perceive their risk of death or severe disease to be as high as others, but we're going to ask them so that they do it so they can protect the vulnerable. So there goes this idea of collective responsibility. I'm going to give you a bit of a sneak peek into some of the work we've done. We ran a vaccine hesitancy clinic at the Alberta Children's Hospital, and we were able to go to our vaccine hesitant patients, and this is just a bit of the work that we've done on this, and say, well, what are the main types of the vaccine hesitant people around COVID-19 vaccine? And we've seen a few groups. One group we've noticed is something we named the bubble dwellers. So these are people who are feeling reasonably safe in their recommendations and their compliance with public health recommendations, so safe they actually don't feel like they need to have the vaccine. The more extremist group, the freedom fighters, are people who obviously they value their freedom, their rights over the safety of society as a whole. Then there is a big group of warriors and waiters. So these are people who are worried about the safety of the vaccine. That is the most paramount concern. Therefore, they want to wait before taking it. And then the return to normals are people who are at baseline hesitant, but who would be willing to take the vaccine as long as it means that there is some semblance of return to normal society, work, schedule as before. And then a really interesting, fascinating group are the exceptionalists. So these are people who, no matter how much science there is to back the vaccine up, they feel there is something about them that's different and special, whether it's their own personal history, their family history, how they perceive their body, so that they are concerned that despite all the science that shows and the fact that we have more than 40 million people, for example, vaccinated, they would still be more susceptible to some rare side effect from the vaccine. So over with 19 to 0, we've worked to try and keep a coordinated education of healthcare workers, and also to keep the message consistent with the three big aims to say we want our healthcare workers to get educated, vaccinated, and skilled. And by skilled, we mean that not just in how to communicate about vaccine information, but also how to take into consideration building rapport and trying to address some of the emotional gaps that we know are there in vaccine vaccine hesitancy. And I'll give you an example. We're recommending and promoting the PROTECT framework of communication, and I urge you all to consider applying this to maybe your patients, maybe your colleagues, maybe your family members, in how, when you talk about this vaccine. So when you start the conversation, start a presumptive discussion, meaning that you're not going to ask them what they think and what they're going to do about the vaccine. You're going to say something along the lines of, I'm here to support you as you go ahead and make the decision to vaccinate. So it's a presumptive statement. Offer to share your knowledge, so that kind of establishes your expertise. And then the next 2 points are really important. I want you to think about tailoring the recommendations to their specific concerns. So don't get into a heated philosophical debate about vaccination, but rather keep the conversation really tailored and targeted towards that particular person. So for example, you may have a friend who's a single parent, and they may not feel the risk of death of COVID, but then you can say, well, think about what if you need to be hospitalized for if you get sick with COVID. Think how traumatizing that would be to you and your child, being a single parent. So that just brings it all into saying this is tailored and only address the concerns that they have. And the last point is talking through a specific plan on how to get a vaccine. And I'll stop here and I'll let my colleagues go on. I'm happy to share more. This is just a little sneak peek, but happy to share more about some of the work that we've been doing.
Well, thank you very much. I think we're going to go back to the archetypes of vaccine hesitancy. That was fascinating. Now let's turn it over to Dr. Raj Pannu.
Hi, good afternoon, good evening. I'm in New York City, so it's evening here. So I'm a little bit of a disadvantage. I don't have any slides like Cora, and I'm also at a chemical disadvantage because apparently I'm the only one who's taken this policy in a pint thing. Oh, there we go. JC, okay. So now we're in the true tradition of this thing. So let me start by first saying that, first of all, thanks to the School of Public Policies, and second to just highlight what Cora, the work that Cora does, because this group that we've put together that includes Cora, JC, myself, is actually a very large international group. And the work that's being done at the University of Calgary, particularly around vaccine hesitancy, particularly done by Cora, this is very unique in the world. And some of the work that she's doing is extremely powerful, and is, people are looking at it all over the world because they don't have this kind of expertise. So I just want to acknowledge that and say that we're very lucky to have colleagues like Cora and JC, in our consortium. So let me tell you a little bit about myself and how I came to be sort of involved with all these exceptional people. So my personal background is that I am a biochemist. I have a PhD in biochemistry from the University of Alberta. And then I moved to New York about 20 years ago, and for a variety of reasons, left academia and ended up in the weird world of advertising. And got a job at McCann, which is one of the largest advertising agencies in the world. And I spent a decade there working in the pharmaceutical sort of vertical of that huge company. And I kind of learned the trade craft, if you will, of advertising. How do we take a product and make it, sort of interesting to the various populations that we want to, how do we engage people to become interested in our product? In the case of pharmaceuticals, it's really both engaging people who are in the healthcare profession as well as, particularly with the United States, the general population. And I would say that, and after that, I actually became very interested in global health. So I worked with the Gates Foundation and USAID and all these different big, gigantic multilaterals on public health issues. I'm looking at public health writ large and seeing how we could get people to become interested in the big public health investments that were taking place in sub-Saharan Africa and South Asia. And what we ended up seeing was that there was so much emphasis that was being put on, like, let's look at vaccinations, like creating the vaccinations, building vaccines and all that kind of stuff, but there wasn't enough emphasis being put on what I would call demand creation, which is creating demand for the products and services that were being pushed into developing countries. And so that's how I sort of became involved in all of this stuff. And then subsequently, I started my own agency I co-founded my own agency with our creative director, Eric Verkerke. And our Emergence is very, very specifically looking at how we can create large institutional demand for different kinds of public interest issues. And so how I got to know Cora and JC is really around this issue of COVID vaccination, because it's a major public interest issue for Canadians, and it is around the world. And as Cora has correctly pointed out, there's a really, really terrible amount of hesitancy. And this hesitancy is critical specifically for the fact that in order to create community immunity, in other words, to have what we call herd immunity or population level immunity to this virus, we need to be either immunized or exposed to this virus at a very, very high rate. It's like around 70 to 85% of the population. And if only 60% of people want to get the vaccine, this is a major, major problem, because we won't achieve that. And this disease, this insidious disease, will continue to exist inside our population and mutate and change and afflict us over and over and over again. And we're beginning to see these variants, which are very troubling, and I'm sure will come up later on, but they will begin to emerge and continue to infect us. So in order to deal with the demand side, this is kind of what I've been kind of a big evangelist in, both in the United States at the sort of highest levels of the US government, as well as in Canada. We need to have a communication strategy that is systematic, that is targeted, and that is intentional. And these three elements, I think, are the key aspects of trying to get people to be aware and understand and make sure that they are, compliant with the right behaviors, and also make sure that they accept the vaccine. And this is a tricky thing. And this is not unique to COVID. I mean, behavior is the key to so many public health challenges in the world. I mean, you talk about, whether it's hygiene or bed nets or health-seeking behaviors, all over the world, there are very, very significant issues around behavior. And so communications is really a really, really critical piece of that. And I think, talking about hesitancy and the COVID vaccine specifically, I just kind of want to reiterate the framework that Cora had mentioned. There are it's a constellation of factors that make people hesitant. And I think we're going to get into that, significantly with JC and Cora, but it's, there are very reasonable hesitations. There are people who have, questions about the vaccine. Is it safe? Is it effective? Was it rushed? Are there specific use cases? Should I vaccinate my children? I have autoimmune diseases and allergies. I'm pregnant. There are very reasonable, specific hesitations that people may have around vaccinations, particularly the COVID vaccine. And, I think from a public health perspective, those are actually more easily dealt with. The sort of second layer of this onion around hesitancy is around sort of lived experience, I would say. There are those who are what I would call vulnerable populations in many ways, who have experienced historical healthcare injustices. I'm thinking about Indigenous populations, Black and Latino populations in the United States. And these populations, have legitimate concerns based on their experiences with sort of structural issues and racism within the healthcare system. And they have additionally lack of access to healthcare. So, you could roll out all these things, and in many cases, in many of these communities, those opportunities to get vaccinated or, experience healthcare that their general population, gets to experience, they don't get to have. And the other thing is there are very, very sort of niche, but true and real specific concerns around things like religious considerations. For example, like I'll give you an example in the United States, in Muslim communities, they're worried about whether or not the vaccination itself is acceptable within their religious context. And then there's the third layer of the onion is something that Cora kind of alluded to, which is around misinformation. There are people who are, have worldviews that are, completely opposite. There are people who believe in conspiracy theories. People who believe that all the various institutional actors that are trying to get people to vaccinate are somehow corrupt. And these are also additional issues. So, I think that, part of the thing that we are trying to do as a group is to, individually parse out these very specific arguments and counter detail them in a variety of different ways. And perhaps we can talk about that, in detail as we move on. But I want to turn it over to JC because, one of the really important aspects is within the social media context. And I think that's where his expertise is the most important.
All right. Well, thank you very much, Raj. And in solidarity, I have a glass of wine here. So cheers. Now, JC, over to you, and let's get into that social media aspect that Raj was talking about.
All right. So hi, everyone. It's a lovely Thursday in Calgary. It's getting warmer, and I'm happy to be here. So I was brought, my field of expertise is actually foreign affairs, and foreign policy and national defense. And for the last couple of years, we've been working with national defense to work on social media listening and kind of developing the tools from machine learning and network analysis to understand narratives on social media and how foreign actors kind of come into the Canadian conversation and shape opinion and things like that. And somehow at one point I got sucked in the kind of COVID and AHS group where I was asked to, somebody from AHS, saw my presentation on Russian interference in Canada and said we could use this to kind of study vaccine hesitancy problems and kind of understand better how anti-vaxxers and pro-vaccine groups are formed, how they share their information, and do that. And so I said yes, not knowing that this would take all of my time, and I didn't have on my bingo card spent a lot of time data management and data handling in my 2021 bingo card. So essentially what my responsibility in that group is to collect massive amount of data on social media, mostly Twitter. We're expanding to Facebook. We're expanding to different kinds of social media platforms, and to collect millions and millions of tweets. Right now, we've been collecting about 1 million of tweets per week since November, since the news that there was actually a vaccine made by Pfizer and then Moderna. So we've started to collect all of this data. And from these millions of tweets globally, we then use machine learning and algorithms to kind of study and read these tweets. In essence, I'm not going to read the millions of tweets a week. And then so we use machine learning and text analysis to kind of do this. And this is really the kind of expertise we're building at the School of Public Policy, where we're using kind of data analytics and computational methods in the policy world and use these tools in an effective way. It's a tool and it's a skill that is in high demand, both in industry, but also in government. And Raj can probably speak to that, where everyone would love to have a data analyst on hand if they could get one. And so we're collecting all these tweets. And what we're trying to do is to create these network maps to understand better the interaction and the connections that people have together when they talk about COVID vaccination. So we create these network maps on COVID vaccination, and then we study these interactions, essentially isolating groups of people, groups of networks of people and Twitter accounts that are mostly hesitant about the vaccine and have like shaped around these connections. We also identify the pro-vaccine groups and people who will get vaccinated. And from there, we can actually kind of look into like, how big is misinformation online? What kind of, how are these groups? In the grand scheme of things, what we find, for example, is that the vaccine hesitant network on social media since the last 4 or 5 months have been relatively stable. And it's about 20% of our data set is usually kind of connected to anti-vaccine conversation. It's not all of it, like Twitter is not the cesspool that people think it is, but it's significant enough where it might shape people's perception and essentially, desire to get vaccinated. A lot of the research that was done in the past showed that 5 minutes of interaction with negative sentiment tweets on vaccination shapes and forms people's perspective on whether or not they're getting vaccinated. So as we're looking at this, we're trying to understand this. So the good news is kind of like 70 to 80% of the tweets that we're reading is actually kind of the pro-vaccine group. And from there, what we do is we use machine learning to read these tweets and essentially, form patterns to understand the narratives. What we're trying to understand is like how these anti-vaxxers think about these vaccines, how can we understand them better? And then when we deal with this data, we provide this data to Raj team and to also to AHS to kind of design communication strategies that speak specifically to this. And also what we're doing is kind of looking at the pro-vaccine group and looking at how they talk about these vaccines, whether or not these forms of communication actually has any traction on the anti-vaccine space, and kind of like understand like these audiences, like thinking like a creative and saying like there's all these different audiences on social media. Can we understand and analyze them like at the granular level that is good enough where we can actually micro-target our communication strategies to kind of fit the way they talk about these issues, and looking at influencers on social media in the anti-vaccine space and the pro-vaccine space to kind of go at it. So we've been pretty okay now. We're producing roughly a report every week, and we're ramping things up where we kind of try to help the creatives and government kind of understand better how they can develop these communication strategies. And the kinds of things we learn is this. On the first hand, on the anti-vaccine space, on accounts mostly related and connected to vaccine hesitancy space, we find roughly 3 big problems. That speaks to what Cora says. So what's comforting for me is that when Cora tells me about her research, it's like, hey, I see this the same thing on social media. So actually I know where things are going in the right way. We're seeing that vaccine safety is probably the most pressing concern for anti-vaxxers. It's about 70% of the tweets that they talk about. It's a lot. It's most of the conversations on safety. Below that, there's actually 20 to 30% of the tweets we read, which are actually concerns about freedom and concerns about like mistrust in institution. And it speaks to Raj's argument about vulnerable population, which have a kind of difficult relationship with institutions. And we're seeing that a lot of the tweets that we're looking in the anti-vaccine space is not necessarily that people are concerned about getting the vaccine itself, more so than they don't trust the institutions, the public health agencies, the government, the big pharma to actually produce the results that they have. And this is interesting for policy perspective, because these are the kinds of concerns that can't be addressed through an information campaign. We can't throw a lot of stats on safety to kind of address these kind of trust issues. What we're really measuring is this kind of lack of trust in the social fabric of our communities that like essentially feeds off the polarization that we saw the last couple of years. And in the grand scheme of things, the communication strategy becomes extremely difficult and where we need to address the kind of information space of the vaccine hesitancy, but also the kind of trust issue, which is more at the societal level aspect of this. And then like the last third, which is like 5%, is like efficacy of the vaccine. Some people are concerned that it's not going to be efficient, but there's less so. When we look at the pro-vaccine group, we find different things. We find a large concern about rollouts. Like the major concern that we're seeing right now is that a lot of people are concerned that the rollouts there's not enough vaccines, they're not distributed enough in the right places, and people want to get vaccinated as much as they want. And there's also what Cora said about like the concern for the return to normal. There's a lot of talk about, we need this vaccine to get back to our normal life. From there, what we do is we use algorithms to actually study the sentiment and the emotional imprint of these tweets. And we're like tweaking the algorithms to get a better information. But what we get is this. In the grand scheme of things, in the anti-vaxxer space, a lot of the conversations about anxiety and fear about and the kind of the emotional imprint that we see in these tweets about those kinds of things. In the pro-vaccine space, we see two things. First, we see anxiety over the rollout, hope that we're going to get better and things will get better if we get vaccinated. And then there's a lot of tweets about facts and conversation. And what we find interesting in this data is that in the anti-vaccine space, it's a lot of fear and concern and anxiety around the safety part, whereas in the pro-vaccine, it's a lot of concern about the rollout, but also hope. And as we're thinking about designing these communication piece, we think, and I think Raj probably will agree with this, that the emotional communication is much more effective than actually creating a lot of information. What we're seeing somehow in government agencies and government communication is a tendency to rely on facts to kind of convince people to get vaccinated, whereas much of the conversation is actually an emotional one, focus on stories and on anecdotes, which speaks better and is relatable to like normal people, whereas doctors and academics are concerned with facts. And if you throw me like a nice chart, I'll be like, oh, okay, the data says this, and I'll do that. And it shifts the way we think about communication strategies to move away from facts, stop telling me how many % of people are affected or not, and talk to me about hope, anxiety, concern, and focus on the emotion. The next step of the research is really to kind of test out these ideas. We have all these hypotheses about all these communities, all these emotions, how different ways to do this. And this is where the creative comes, where we kind of test out these hypotheses in real time, design communication strategy that speaks to these kinds of segments, and then test out on social media and to see whether or not these interventions goes anywhere. And then we get a better sense of how to design communication strategies that are much more effective and hopefully move, I always say like my goal is to move 5% move the needle by 5%. If we move the needle by 5%, I think this is like a massive, and in social science, it's a massive impact on policies. And we've been really grateful and to work with the kinds of specialists that we have. I'm gonna keep it that way because I think it's been 6 minutes.
Well, thank you very much. So right now, I would like to just say two things. First of all, I spoke about the poll in my introductory remarks, and the polling question should appear on your screen, Ashley. I believe you are in charge of that. And I encourage all participants here to click on the answers, and as they tabulate them later, we'll get a better sense of where our audience is. So please go ahead. I will participate too. There you go. I've participated and submitted. I hope you have. The second thing I wanted to mention is that it's Dr. Raj Pannu's birthday today. Happy birthday, sir. Thanks for joining us. This is like a party with your 86 or so best friends, right?
I'm happy to be with Albertans at this crucial milestone in my life.
Well, happy birthday. We're super happy you could join us. Now, I just wanted to go back to first principles here, and we got a really first principle type question from the audience that I think Dr. Cora is the best positioned among us to answer. An audience member says, how do we assure that the vaccines are safe and recommended to all types of people? So, this is the medicine part, the research part. And so first of all, have they been rushed? Are they safe? Let's go ahead and go straight to the first principles there, Dr. Cora.
Sure, I'm happy to do this. So, I'll answer your question, and then I'm definitely going to address Andrew's question as well. So have they been rushed? Yes, in a good way. And I really think we need to change the conversation a bit. Have they been rushed? For sure. Vaccine development was incredibly slow. Oh, for the HPV vaccine, more than 10 years to get it to market. So definitely in a different way. What hasn't been rushed, though, and I want to stress this, is the safety component. So for example, what's enabled them to go so fast is that a lot of these platforms were already pre-developed. So they already had the platforms in place, like the mRNA platform, the adenovirus platform. So the pre-clinical candidate part, which takes years and years and years to develop, was already there. And then they were incredibly efficient. So a lot of the red tape of administration and funding just wasn't there because now with the global focus on this vaccine. And also they were constantly thinking ahead. So I actually heard the Moderna folks talk about how at the phase 1 trial, they were already spending money and securing their phase 3 sites, taking a gamble on whether it was going to work, but doing all of that ahead of time. So instead of they talk about an adaptive development. So instead of like the sequential bit by bit, things are going on at the same time. What I do want to outline, though, is that usually it takes about 6,000 to 8,000 participants in a phase 3 trial to get a vaccine to licensure. These trials had 20 and 30,000 participants. So it's not like they did not compromise on the numbers and on the safety component. Now, within those phase 3 trials, there were a lot of subgroups and sub-analyses. So they had in most phase 3 trials that they've done so far, about 30 to 40% of the people were from from different groups. So you had people of color, Black, Latino people, 30 to 40%, including sub-analyses by age, because we know that in older people, the vaccine efficacy in the past has not been as good. So they've looked at sub-analyses among, the people of color, Black, Latino people, as well as doing older age groups like over 65 and 70, and the vaccine maintained efficacy in the various age groups or had very close efficacy to that. So the science is there, but that's only part of the hurdle, which is why we're having this session. So the next part is, how do we bring that science and that communication to those groups? And it's definitely not me. So, me showing up and talking to these groups would not do anything. So this is where we have to support with the materials, communication strategies, members of these groups, so they can actually hear it from their own groups about the safety and efficacy, because that's when it's trusted information. But it's there and it's been done. We just have to work on making sure it reaches the groups via the right channels.
Thank you very much. I think we have another poll question here. Let's answer and submit. But okay, well, thanks for bringing the medical perspective on vaccine safety, and each one of you in your own way addressed the question of communicating all this. So Cora, you ID'd, the vaccine hesitancy and introduced that protect communication strategy, I guess you could call it, or tactic. Raj, you talked about the different rings of the onion on public opinion, and JC, you looked at, the models you're looking at. So in light of your perspectives, and I'll throw this one maybe to Raj as the advertising guru, but what does communication strategy look like once you take all these scientific elements and the knowledge that JC's coming up with, and how do you design, and how do you bring together elements, and what does that communication strategy look like?
That's a great question, and I think the answer is that it's not uniform. It's actually multimodal. So while Cora is being humble and she says it's not her, but it is her. It's finding the right important people who have a lot of influence in the public. Cora probably won't tell you this, but she's a major public intellectual on this particular issue. And for her to go out into the media and say things about vaccines, and particularly, describing it the way she did, why we should trust the data and why we should not be concerned about, for example, how quickly, the mRNA vaccines, for example, this platform, which by the way has been developed over a decade or so, has really come to bear on this particular issue. That's a really key point. So public relations with, renowned experts is a really key part of this. The second part, of course, is persuasion, and that's where I come in. And so on the persuasive side, there are different audiences that you have to persuade, right? So, segmentation is really, really important on multiple levels. So the first is around job descriptions, because developing healthcare workers and those people who are responsible as on the front line of interacting with patients and making them advocates is a really, really critical part of this, because the most trusted sources of information in any setting in healthcare are those who are healthcare workers. And as Cora said in the beginning, the really concerning part of the data that we've seen is that healthcare workers have approximately the same level of confidence in vaccination as the general population, which is far too low, far too low. It is about 25% too low. And while I do think, it may be that the healthcare workers who are skeptical for, reasons that are completely reasonable. It's really important that these kinds of communications go out to healthcare workers to make sure to mitigate those particular issues that healthcare workers have. The second is around the general population. That also involves segmentation, and there are many different kinds of segmentation. So if I look at Canada and the United States, they're very different. In Canada, we have a single-payer healthcare system, public healthcare system. So that, so access is an issue in Canada, but it's not as great an issue, for example, as it is in the United States. But experience is a big issue in Canada. There are a lot of people who do not see within their healthcare system the kind of faces that are, understand their personal lived experiences. And that is something that needs to be addressed. I just want to say to your audience in particular that the key issue here is entirely one based on the fact that it is not mandated to have this vaccine by the federal government. So in other words, there is one possibility, which is, I don't care what you think, everybody has to get the vaccine. That's not the case here. So as a result, it's left to individual choice. And if that's the case, it is absolutely essential that a communication strategy be deployed to make sure that people understand what's important and why it's important. And because, here we're in a situation, it's an existential situation. We have economic considerations. We have, businesses going bankrupt, every hour that we sit and wait and talk about this. And then we have this, virus that's, kind of wreaking havoc upon the population. And how do we, and then of course there's the social dimension too. I've been stuck in my house for the last 9 months. I haven't seen anybody. And that's true for me, it's true for everybody. So how do we reconcile all these situations? It's a very complex and yet critical situation that we're in. So communications is an absolutely essential component of this, and making sure that we, stratify and reach out to all of these specific communities and address these specific hesitancies. It may be that, and I'm certain this is true, that we won't be able to reach everyone. There are skeptical communities that have been so adversely affected either as propagators or recipients, and I'm going to leave this to JC to talk about right now, of truly, of information that is that misinformation on a level where their health and the health of their loved ones is at risk. That is the case. And it may be that we don't reach any of those, but we need as a society to really, really push the communications piece of this to try to get to as many people as we can and make sure that we get vaccination up to the highest level that we can, because our entire society depends on this. This is DEFCON 1, if that's the right term. We are in that critical situation. And there's never been a more complex and this communications issue, and there's never been a bigger communications emergency than we have now. But I'll give it over to JC to kind of comment on a lot of this disinformation.
Well, before you jump into the disinformation, let's see if the polls that we did of our audience match sort of your aggregate findings from social media. Can we pull the results for poll number 1, please? So, hey, look at that. 84% of us are vaccine accepted, I guess.
That's higher than what it's supposed to be, which tells you that, the group of people that are here probably self-selected themselves in a sample.
No, we've convinced them, JC. We've convinced them.
There should be a before and after poll.
Exactly. Or you're right. Or we should do just one webinar at a time, getting to 84%.
But yeah, I think there is a selection effect for sure. Higher education, and you were talking about segmenting your audience, right? I mean, I'm sure a lot of the folks here are university graduates and interested in this topic anyway. So there's a selection effect to be sure. Even things like accessing internet to do a webinar, puts you in a different socioeconomic stratus. Now, poll number 2, let's look at the results here. Okay, so social media has not influenced, I guess 25% of the folks, or sorry, 75%. And what do you think of that, JC? Social media influence, you wanted 5%, you got 20 here.
I mean, this is something we always talk about in our group, right? Is that, there's a real danger of trying to preach to the choir, and on vaccine hesitancy, that actually doesn't move the needle. Trying to convince people that are already convinced actually doesn't change anything, doesn't change people won't get 3 vaccines to make up for the people who don't get any vaccine. So one of the things we're trying to always think about is that vaccinable middle, right? That we know, and Raj is right, there's a 15%, that we'll never convince. And then there's a 40% who we don't need to convince because they're already convinced. What we're trying to kind of segment is that middle group where they could go either way. They could really kind of be shaped by the information around. I think here the data is kind of 84% will get vaccinated, which is higher than the national average, probably because people are already convinced they're going to get vaccinated. So any kind of information kind of doesn't sip in. But it speaks to the kind of things we're seeing on social media, where these echo chamber effects are extremely dangerous and kind of difficult to pierce, because all of us on both sides kind of suffer from confirmation bias. I already know that I want to get vaccinated, so any kind of information that comes in actually doesn't change my opinion because I'm going to get vaccinated. And all the people who will never get vaccinated, the information that comes in actually doesn't pierce through because they're not going to get vaccinated. Thus, they reject that information. So engaging in that kind of information back and forth probably just reinforces these kinds of confirmation bias. And this is one of the things we're doing with our network maps, is that we're actually able to identify quite specifically who are the influencers in these spaces, right? We actually now have a really good understanding of who are the main influencers in the anti-vaccine space. And they're not all anti-vaxxers. There's a lot of accounts that get deplatformed in the US and in the UK, less so in French, but a lot of people are getting knocked out of Twitter and Facebook. But there's a lot of other people, leaders in our society, in our communities, which could be the kind of influencer that actually are trusted by mostly by anti-vaxxers, and allows us to kind of carry our message to a group of people that are important. That's why like studying this in a network effect is actually way better. A lot of the, and this is how like the micro targeting is going now for communication, where, you know, if I can have somebody who you trust already to speak to my product and vouch for my product, that information will have a lot more influence than if I do a mass carpet, like, you know, marketing strategy that actually just do a billboard somewhere. If I can get you, JS, to sell this to your spouse, your partner, your friends, that weak link actually has a lot more impact than just putting a billboard and trying to do this. So one of the things we're trying to think about is like, can we identify these influencers in the anti-vaccine space? Can we convince them, if they're not anti-vaxxers, to kind of be like, you know, like essentially like spokesperson for these things, and then kind of make this thing. In the pro-vaccine space, what we're seeing is that the healthcare workers are central to a lot of these networks. Their engagement on social media is actually really good for those who are there. Things that are concerning, we almost don't see any kind of public health institution or government, you know, like action on vaccine hesitancy. So the WHO, the CDC, PHAC, they're not on social media. They're not doing that work, which is really concerning, because they should be the people who kind of do this. But it allows us to kind of understand better like these, like, you know, networks and how to go through these echo chambers.
All right, we're almost going to get back to audience Q&A, but we have the final third poll to see what our audience, mandate, look at that, almost 50-50 split here, pretty close to, wow, interesting, eh? A lot of people want a mandate. What are your thoughts about that, Dr. Cora? If you have to fight people to put jabs in the arms there.
Listen, if you want somebody to give you the pros and cons of something and then not commit to anything, ask a physician about it. So I'm going to do that. Okay. So mandates. Yeah, that's a tough one. So first of all, I think people need to think, what kind of mandates are we talking about? Because interestingly, when they looked at this in the nationally across Canada, when people were asked whether they want the government to mandate this, that was poorly received. So about 40% said yes to that. Most people didn't want that. Different story though when you ask about mandates from employers, for example, that was closer to 80% on those kind of polls. So it's different interesting to think about what mandates you're talking about. I'm not really into coercion and convincing. I'm big on supporting people as they make this decision. And I speak as a physician. This is where I'm coming from. You know, at the end of the day, nobody's going to ask me whether we should make this mandatory or not. I'm not going to be part of that policy for sure. But I tell you, I can see the advantages of having something mandated in, let's say, nursing homes, or even in places where we've had a lot of outbreaks, like the meat packing plants. You can see the value there that a vaccination mandate would actually have an advantage in those settings. And then you can also see it from the point of the employers who will want to protect their staff and want them vaccinated. And then you can see the view of other people who say, well, I don't want my rights to be imposed upon. I think realistically, legally, this is such a hot mess that it's hard for me to imagine how anyone's going to come with a final answer to it. I'll tell you though, from before COVID, when people looked at mandatory vaccinations for children, so we're talking about, going to school, or they didn't seem to work in terms of uptake, and it didn't seem to really improve uptake for a variety of reasons, mostly having to do with philosophical, religious, health exceptions. So that's the other thing. People are very good at circumventing rules and mandates. And if we're going to allow for that kind of stuff, that might put pressure on the healthcare system in a different way without necessarily reaching what we all want, which is to get more people vaccinated. So for me, in my darkest hour, when I feel really angry at the COVID world, I just really want a mandate so bad. But from what we know in the past and thinking how we would operationalize that, I'm not so certain that that's the answer. So I'll leave it at that. How's that for a non-answer?
Well, I'm going to call on you again because there are a couple of questions from our audience members that are, I think, close to your bailiwick as well, about the trust in experts, the trust in the medical ecosystem, because here are two related questions here. One of them talks about how scientists seem to not disclose everything they know about COVID. And that causes people to lack in trust over the experts. And another participant mentions, the early, the early decisions to not close the border. Or you remember when Dr. Tam said, "Don't wear a mask; it's dangerous." And now, now we're asked to double up. So so all these factors. Several questioners look at trust in the medical community. So how would you address those fits and starts, or the non-knowledge about COVID that people seem to be thirsty for?
Yeah, I tell you, these are things I've struggled with personally myself. I'm with you. Nobody mask. Now we should all mask, and now we should double mask. And a lot of this has changed, and you can see how this is hard on people. And in medicine, we struggle with the gray of the situation a lot, and we spend years getting comfortable with that gray of the situation. And even then, a lot of us, a lot of physicians, healthcare workers are not comfortable with it. I tell you, this is why it's so hard to be categorical about anything today. And I'm very suspicious about people who are so categorically in one way or the other, because we need to maintain this humility about how much this pandemic has taught us, how much this new vaccine development has taught us. There's so much we don't know. And I completely agree with whoever put that question out there. We need to get better at communicating that. And I'll give you an example. Now everybody talks about, do we need 1 dose of the vaccine? Do we need 2 doses? Should we just go ahead and vaccinate everybody with 1 dose? Biologically, this makes sense that maybe we should get everybody vaccinated with 1 dose while it's available, because maybe we can take a bite out of the outbreak short term. But that also distorts the science of vaccination a bit. This is not how these vaccines were studied to begin with, and leads to this inconsistency, and inconsistency equals hesitancy. So I am with you. It's frustrating, and we all need to get better at communicating that and somehow leading the world to think it's okay. Because the reason people feel uncomfortable with this is this, okay? So you've heard the Aristotle versus Brene Brown kind of saying that humans are rational beings who sometimes feel, and then now we think, well, humans are actually emotional beings who sometimes think. At the end of the day, behind all this lack of trust is fear. So nobody likes changing recommendations, because it makes us really scared and afraid. And we need to learn to validate people's fears, because that's why people lose trust. They lose trust because they're overcome by a threat to themselves, their family, their jobs, their livelihood, some kind of fear. So we need to learn how to communicate that and to validate the fear. And I tell you, I know that because when I see vaccine hesitant patients in my clinic, that's what it's all about. They're scared. They're really scared of whatever they perceive. And that's where the common ground is. Who has not been scared in this pandemic? Raise your hand, because this has been so freaking anxiety, provoking from the beginning. And maybe this is where we need to build a common ground as healthcare workers with people. Maybe this is the one commonality we've all had, is fear about something. And then if we can build that common ground and validate their fears, we can help build their trust. Anyways, before I go further down, I'm gonna stop there. That was a bit of psychology to you all.
Well, no, this was very, very needed, because it has bothered a lot of people, the way that our the public health authorities seem to have changed their mind, and that increases mistrust. But I'm reading through. Thank you for those excellent questions, by the way. One of our participants, Maureen, says that it's also her birthday, and so she wishes Raj a happy birthday. Also, a couple of questions for Raj. Going back a little bit to the mandate, a couple of people wanted to hear your thoughts as a marketing and advertising guy on mandates. And then a closely related question is related to Prime Minister Justin Trudeau here. And I'm quoting here from the question, what influence does it have when a Prime Minister says to Canadians that by the end of September, all Canadians who want a vaccine will be able to get a vaccine? So should the Prime Minister be made aware of how important it is to reach that herd immunity you mentioned that is somewhere, if I remember right, 75 to 85%?
Sorry, I'm having a few connectivity issues. I'm going to try to resolve them here. Can everyone hear?
You just froze now, just on mine anyway. So I don't know, while Raj tries to reconnect.
Sorry.
Oh,
okay, here I am. Is this okay? Does this work?
Yes, I can hear you well now.
Okay, first of all, happy birthday to this individual who was born on, we're both Aquarians, proud Aquarians. Secondly, I just want to reiterate that like Cora's answer was so profound, and I just want to acknowledge that, that's why she's a major thought leader in this area, because there are institutional answers to things that are really sort of well thought out and well rehearsed, and meet whatever the guidelines are. And there's the kind of research that Cora is doing, the kind of work that she's involved in, which really meets people where they are. And this issue of as human beings, we have fears and we want to make sure that our fears are alleviated. That's absolutely critical. And I do think that's a driving force in the vast majority of these issues. So before I speak to mandates, because I do think it's a key thing, let me just say that what's fascinating about the time that we live in is that everything is political, right? So right now in the United States, right, we have this massive snowstorm that's happening in Texas, which is a very rare event. And this is now, the Republicans who run Texas are talking about, it's about the Green New Deal and renewable energy, right? And the Democrats are saying, well, it's about lack of investment and all these kinds of things. And, of course, there's the realm of truth, and there's how disasters are politicized. And no disaster has been more politicized than COVID, right? Because it is such a spectacular disaster. It has revealed really sad and disgusting truths about our societies in terms of the inequality that exists. And so it's the politicization of COVID that is, in many ways responsible for creating a lot of the myths and stories that are leading to many of these different issues. And so then we go back to what JC was saying, which is about facts versus stories in terms of communication, right? So there are facts and there are stories, and there's emotion, and then there's rational thought. On the fact side, there are numbers and percentages, and we've talked a little bit about that. But this kind of goes back to also what Cora was saying, which is getting a vaccine isn't just putting something in an arm and getting a statistic done, and and making sure that there are public health issues that are accepted. This is a way of protecting our families. It's a way of protecting our friends. It's a way of returning to normal and getting our kids back in school. It's a way of returning to business. There are so many implications for society that are tied directly to what we're doing in terms of the health implications. And it's within this space, in fact, that I am personally deeply invested, because the fact is, if you ask me, I'm also a virologist and a biochemist. So do I know that vaccines work? I know that they work. I understand the principle of vaccination. I know the dangers of vaccination. I know that, you know, by and large they work, and sometimes there are terrible side effects, and these are, you know, that's why they have trials, and that's why all these things happen. But that's not helpful to the majority of people, because there is a fear that Cora talked to, and a trust, and it's that balance that we have to deal with. And I do think that storytelling is absolutely critical. Now, moving on to Prime Minister Trudeau, I understand that, you know, there's political issues. This kind of goes to the politicization that I was talking about. But the fact is that it's, you know, obviously it's tough to be a leader. And I don't care whether you're Kennedy, or Jason Kenney, or whether you're Prime Minister Trudeau. Being a leader in this difficult time, balancing all these nuanced and complex issues is very, very, very tough, right? Because people are saying open businesses because my business is failing. People are saying I'm worried about my child. All of these things are simultaneously true. And it doesn't matter what side of the ideology spectrum you are, you're still going to be dealing with these complex issues. I do think, however, that, you know, and this is where I believe what Cora says and what JC says is that, you know, science ultimately will tell us what is the right approach. And there are going to be mistakes along the way. And the problem is this inconsistency in terms of the ability for us to communicate around this has been a big, big problem. Partly, one of the reasons why, you know, JC, Cora, and I and others have signed on to this 19-0 group is that we want to kind of take this outside of the political realm and say, look, there's a bunch of doctors, there are people in the private sector, there's people across the political spectrum, there are people across the economic spectrum that are interested in getting back to normal life. We just want to get back to a normal life where everything, where this thing doesn't exist. How do we get this thing to zero? And part of that, and a really critical piece of this is getting vaccinated. And, you know, that is making sure that the doctors have the right information to make sure that they don't vaccinate the wrong people who may not be, you know, eligible. It's also making sure that people in general have the right information and know what's at stake for them. Making sure that they understand that if they're just doing it, they don't want to get vaccinated because, you know, I don't give a shit. I'm sorry, I can say that because there's booze involved in this discussion, but you know what I'm saying, that if to make sure that people are armed with both the emotional arguments as well as the scientific arguments to make those kinds of decisions. That's kind of what my job is. On mandates, I agree with Cora. It's complex. They're going to be, businesses may mandate if governments don't mandate. Foreign governments may mandate even if domestic governments may not mandate. And so there's a slew of legal complexities around this that aren't just simply, does Trudeau tell everyone to do it? But that doesn't mean that everyone shouldn't do it. Everyone eligible clearly should do it. And, you know, it's our job collectively, as not just the people who are trying to explain this to Canadians, but as ambassadors for this, to kind of spread the word and to say, look, this is the right thing for our country, for our community, for our people, for our families, for everyone to do the right thing and get it back to normal. And that's what we're trying to do.
Thanks, Raj. So I've collated a few more questions. I'm going to get to JC because there's a couple of really interesting ones on conspiracy theories and related things. But Cora, several participants have asked about side effects. Are there a lot of side effects, and are they severe? Could you answer that, please?
Yeah, so I also was briefly looking through, and somebody was talking about what is a side effect. So any untoward effect of the vaccine would be kind of fitting into the side effect component, the side effects side effect of the we call them adverse events following immunization. They get a grade from grade 1 to 4 in terms of what's mild, what's moderate, as you need to go into to see a medical professional about it, and does it actually limit your ability to do your daily functions. So all these things kind of play a role in the adverse events following the immunization. The mRNA vaccines that people have looked at, and this is just for the mRNA vaccines, seem to be a bit more reactogenic than the other vaccines that people have, the other vaccines we have in the past. How reactogenic is a bit interesting. So, 5 to 6 out of 10 people will have something like a fever or a sore arm or a fever or some kind of a headache, but only 1 out of 10 will actually call the soreness of the arm, for example, only 1 in 100 will call it severe. And then we know that some people say, somewhere between, again, 7 to 8 out of 10 will say that I did have some kind of effect afterwards, but only 1 in 10 actually require Tylenol or Advil for it. So I think, we're soliciting a lot of these adverse events, which are there. We know it's reactogenic. It's a very immune triggering, this vaccine, which is how it's so efficacious. My gosh, we're talking 95% efficacy. Let me tell you that is not what I predicted. I was so glad to be wrong. I thought it was going to be more along the 60 to 70%, and these mRNA vaccines, they're showing 95% efficacy. So, and all vaccines seem to be really good at preventing severe disease and death. So they are more reactogenic, but you have to think of side effects as a bit of a continuum. Is it a grade 1, or the very severe side effects are incredibly rare, and most of them have to do with allergy or anaphylaxis, which we know that 90% of them present in the first half an hour post-vaccine, which is why we're asking people to hang around for that kind of time frame post, so they can be helped by a medical professional should they have that kind of side effect.
Thank you for clearing that up. For sure, that has people worried. And as far as I know, there are no side effects from the 5G chip that they implant in the vaccine either.
Well, we haven't done the long-term studies yet.
And so now that's a good segue for JC, because we have several questions related to different, conspiracy theories that are out there. How do we counter misinformation and conspiracies in today's interweb? And also an interesting question, if you found, for example, you talked about echo chambers, and I think that's going to be the answer, but is there any communication between anti-vaxxers and pro-vaxxers, or do they kind of sit in their own silo and never talk to each other? And a third subsidiary question is, how can we communicate as individuals, because you mentioned that earlier, to dispel some myths, once you acquire the data, how do you go, so it's a question about the funnel. So the broader conspiracy theories, do they talk to each other? And then how can we communicate to the people around us?
Right, so all easy questions, right? So on the interaction between networks, they're actually, so we've been doing similar work with the HPV vaccine, and to be honest, the COVID vaccine conversation on social media is a little bit more interactive than on other vaccines. So we were looking at HPV, and it's like they're completely different from each other, but on HPV there's almost no interactions between pro and anti-vaccine conversations, whereas on COVID there's a lot of intersection, which tells us that at least there's some hope that we can actually get somewhere. In terms of disinformation and conspiracy theories, what we're getting right now on the data is that although we're seeing it, it's not as prevalent as people think it is. So a lot of groups around the world are like hacking at this, like disinformation and misinformation, and we need to fight this thing. And yes, we need to do it, but it's not as important as you think it is. A lot of people, and this is speak to Cora and Raj's argument, a lot of people are just afraid, and those fears are actually, kind of they are legitimate. and they're not really what you would assume is misinformation or these kinds of things. So what we're seeing right now is that Twitter and the platforms are really fast now at deplatforming a lot of these accounts. That's the reason why we're doing the data weekly, because these accounts disappear in 5 seconds and they reappear somewhere else. So we're getting somewhat a better conversation, or a better quality conversation. In terms of fighting disinformation, I think and I think it speaks to Raj and Cora's argument, is that there's a danger. What concerns me a lot is essentially like the backlash of trying to engage the wrong way with those people, right? So some of the things that concerns me, and we're seeing this on social media. So for example, last week, we're looking at the data from last week. There's a lot of backlash in the anti-vaccine space toward Spain and Greece, who now say they're going to put a COVID passport. So a lot of people are saying, like, this is a way to target people and target freedom, and that kind of generates a lot of mobilization on social media, and it speaks to kind of like try to engage in the wrong way from a fact-based perspective instead of an emotional perspective. A connection actually produces this adverse kind of reaction where people kind of fight back and then get entrenched into their vaccine hesitancy, and it then makes the thing worse, right? And a lot of we're like, for example, there are like people in like Saskatchewan, they're doing research on disinformation, that they see that when they're trying to fight disinformation with more facts, it actually has the reverse aspect where people kind of like get entrenched and then like don't listen to you anymore and essentially block you off, and then you don't interact with them anymore. I think, and this is why we're kind of going back to the emotional thing, where we might not be able to change people's like facts or understanding these vaccines, but we might be able to change people's attitude toward vaccination. And that's kind of a different kind of take, right? Instead of going after from a fact-based perspective, we go from an emotional perspective, a connection that is relatable to what Cora talks about, that this kind of fear and kind of being like legitimizing this fear and this reaction to these conversations, and say like, yes, this is a difficult conversation we're going to have. We're not going to hammer you with more facts, and we're not going to belittle you with these kind of like charts and stuff, and like, why don't you understand that these are the facts? We're going to engage with you on a more personal level, on a more emotional level, to actually understand what you're living, address and acknowledge your live experience, and try to move on the conversation to a much more productive kind of way of doing this. And I think this speaks to what like Cora is seeing in our data, and what Raj is trying to do with all these communities, which makes this super complicated to do. It's actually really hard to do. Like, in some ways, we see like billions of dollars thrown at vaccine research and all of this. And then on communication, we kind of just assume that people will line up. And then we realize that, hey, it's kind of harder to kind of convince a society to do the things we want them to do. And we don't spend enough time kind of engaging in that space. I try to keep this.
Well, no, thanks. And I think you've also touched on at least 2 or 3 of the other questions that I've been monitoring, because some of them do touch that intersection between, communicating with people without belittling them or hammering them with facts. And that seems to be the crux of the issue, right? And so I think you've each attempted to address it. One other thing that comes up that I found really interesting is the question here on length of time that we might be kind of stuck in this situation. So we hope to have maybe the herd immunity threshold vaccinated maybe in the fall here in Canada. I think the U.S. As of a couple of days ago, the U.S. has vaccinated more people than live in Canada. So good on you down there. But I've mentioned to friends of mine, the lingering effects of the pandemic, psychological, in a year, 2 years, if I'm sitting in a bus or even an airplane and someone coughs, near me, like, I think I'm going to have like PTSD or something. How long do you think, this current situation will last with, with respect to COVID? We've been hearing more and more lately about, that it's probably going to be in our ecosystem forever. And, so we might have a vaccine like we have the seasonal influenza, or at a minimum, we just have to be better at pandemic detection and reaction. So what are your thoughts on how long we're in this thing for, and what's, a year or 2 or 3 years down the road? Gosh, how about Raj? You're in New York City, the kind of the world city. What's the feeling down there?
Well, there are a lot of elements to your question. I think, the extent to which this virus is going to persist, this particular virus is going to persist, and the variants are going to persist is really an open question. The people are, and I'll leave this to Cora to kind of talk about in detail, but I would say that medical expertise is concerned about the variants because people don't know whether they are more dangerous and more lethal, and whether there are further variants that could potentially make matters worse. So that's a real concern. Whether you're talking about pandemics in the future, this has been an issue, and I've been involved in this to some degree. There are a lot of known viruses in the world that are currently animal viruses that people are worried about becoming introduced into the human population. And the question then becomes, do we need to have a bigger global surveillance system to really study these viruses and understand them? And I think that is absolutely right. And I'm speaking as a scientist, who has been involved in at least some of these discussions way back in the day, that this is not a new thing, but I do think the fact that we just had a pandemic is going to increase our, concern about this issue. And that involves our discussions of international development and working with foreign governments to really understand the origination of these viruses and how they can be introduced into human populations. What do those kinds of surveillance mechanisms look like? And international collaboration is a really key feature of that. You're lucky in Canada where you have a government that is very interested in international collaboration. We now are in the US more interested than we were a month ago, so there are some positive signs there. Just lastly, this is around, on the communication side. Look, this is a very, very difficult thing, and unfortunately, as JC and Cora pointed out, like there are legitimate, illegitimate concerns, and whatever these concerns are, they're being rapidly disseminated through this complex network of media that we have, and despite even Facebook and Twitter and these other social media's desires to kind of clamp down on these things, the ability for these things to sort of spring up and clamp down and spring up and clamp down are enormous. And, it's currently well beyond their ability to police. What does this mean for communications? This is kind of what I go back to, which is why we started 19 to 0 in the first place. I think that if we can create this kind of credible, group that is enormous and across, that includes public, private sector, academic, civil society, a large consortium of interests that, and government interests, so that there's no doubt that what we're telling people is the truth. And, even if people are wrong, and people are wrong sometimes, and Cora kind of pointed this out, like, there hasn't been a global pandemic in 100 years. And even back then, the science wasn't that great. Hopefully there are a lot of lessons that are going to be learned from this. But the reality is that there's an iterative process. People are trying to keep people safe, and sometimes they oversteer, sometimes they make the wrong decisions. And it's not necessarily that people are pushing an agenda. It's sometimes that people just, make wrong decisions. And I do think that there has to be a little more, within society, a little more kind of recognition of the fact that this is an unprecedented situation and people are trying to do the best they can. I'm confident personally that science is going to be the answer and science is going to get us out of this. I just want to recognize that NASA and the JPL just landed an amazing Mars probe on the moon on Mars this afternoon, which tells you where the status of science. We're doing amazing things in the world, and we just have to communicate them in a way that people can understand and accept them.
Is there, JC, this might be more your bailiwick, or maybe Dr. Cora, because you participate presumably in medical communities and all this, live. But are we an outlier in Canada? Are we right in the middle? Are we average? Are we in terms of vaccine hesitancy or mistrust? Or how does the world look like compared to Canada?
Do you want to go? I'll go super fast. So the interesting part of our research is that we're actually collecting all this social media, like this digital information from across the world in both French and English. So we're actually kind of measuring and seeing these international networks. One thing we're learning more and more in the social media space is that there's no such thing as a border in the social media space. The conversations we're seeing in the US infect Canadian conversation. And there's a kind of really strong connection between the pro and anti-vaccine groups across the world. I would say there's more division between the pro and anti-vaxxers than there is by nation. We can identify, we can see like the UK group and we can see the US part. The Canadians are usually, to be honest, usually part of the US conversation. And we actually see this, the Canadian anti-vaxxers are with the American anti-vaxxers and the pro-vaxxers are with the American pro-vaxxers. I can see our prime minister super close to the president of the United States, and we can see that these interactions are more common. So in the grand scheme of things on social media, I mean, we look like every other nation. These interactions are now global, which makes this complicated in a grand scheme of things, because then government are kind of like, what do I do? Do I fight this information coming from the US? Do I fight this information from how this in international environment feeds into the domestic environment? And all of these kind of make sense. And we're still kind of siloed into, especially in Canada, by province, by nation. And on social media, these things don't exist as cleanly as you think they do.
Mm.
They actually did a study earlier on they looked at 14,000 respondents from I think 19 countries, and they asked that question, how likely are you to get a vaccine? And then they looked at it by nationality. And they ranged anywhere from Russia, just over 50%, to China in over 90%, around 90%. And Canada was right smack in the middle third, around 60-some%. So, but I think, but what I want to say to people is that we cannot get complacent that this is where we're at and this is where we're going to stay, because there are so many factors, like JC and Raj pointed out, that all play into this vaccine hesitancy, vaccine acceptance, trust, that just go on, which is why we have to be so proactive and constant at this. At no point can we say, oh, well, 75% of Canadians want to take the vaccine, therefore we're good, we're going to reach herd immunity, because that can change so quickly, because the anti-vaccine movement is strong, that there's this emotional charge of the pandemic, this virus is at us, and our tempers are fried. And I think all these things play big role for us all to say that our job is not done yet. And your job, going home, and Raj mentioned about community protection, I like to talk about community influence. You can start playing a role in how you change this vaccine conversation to your friends and colleagues, and you can become a champion of this vaccine to your circle of influence, because they trust you and they're going to listen to what you're saying. So go home and talk to at least one other person positively about this vaccine and tell them how you're going to get it and how it's going to be the way out out, and then that can change social networks, you know, very in a powerful way, the same way that we see social media can change, you know, opinions and so on. So that's my challenge, is you can be part of the community influence already, even before you've had a vaccine, to be part of community protection. And we know you're that group because 85% of you want to take the vaccine when it's available.
How, like, that's it. This concludes our presentation on the perfect message. Thank you. That was awesome. That was perfect. So it is 5:30. We've had an excellent discussion, like no shortage of questions. Definitely 3 people who are super engaged and involved in this most important endeavor. Thank you so much for taking time out of your day today. And especially Dr. Cora, thank you for all the work you do on the front lines there with real people, sick people. Thank you so much for everything you've done and will do. And thanks to JC and Raj for, you know, helping on the communications front. Hopefully we'll see some amazing results, and we'll get to that 85%. So thank you also to our audience for joining us today. We love putting these webinars together, and we have lots more great events coming up. So please visit our website at policyschool.ca. There are events from the School of Public Policy, as well as the Simpson Center on Agriculture. Again, thanks to the participants, thanks to the panelists. Enjoy this Thursday evening, and we look forward to seeing you in the next few weeks for another Policy in a Pint. Good night, everyone.
Thanks for having us. Bye-bye.
Happy birthday, Raj.
Yeah, happy birthday, Raj.